It started like any other Tuesday. DM, a 54-year-old man, laced up his boots, grabbed his water bottle, and drove to the same trail he'd hiked 100 times before. He was back home by noon. 3 weeks later, his wife found him sitting at the kitchen table staring at the wall. She asked if he was okay. He turned to look at her and said nothing. Not because he was angry, not because he was tired. He opened his mouth, and the sentence just dissolved, like he'd forgotten how language worked. His wife called 911. The paramedics ran every test they could think of. Stroke? No. Brain bleed? No. Drug overdose? No. But DM was not normal. Something was eating his brain, and nobody knew what it was. Welcome back. I'm your host, and today we're talking about a disease that almost certainly killed this man, not because it was untreatable, but because every standard test said it wasn't there. This is the story of Borrelia miyamotoi, a tick-borne infection you've probably never heard of that mimics Lyme disease, tests negative for Lyme disease, and can quietly destroy your neurological function while doctors chase the wrong answer for weeks. If you've ever hiked, camped, or spent time in tall grass, stay with me. Because what happened to DM can happen to anyone. And the most dangerous part? Let's go back to the beginning. DM is a 54-year-old man. He's a regular hiker, healthy, active, no major medical history worth noting. He takes a mild blood pressure medication. That's it. In late July, he completed a standard 6-mile trail hike in a wooded area in New England. He doesn't remember feeling a tick bite. He doesn't remember finding a tick on his body afterward. He showered, ate dinner, watched TV, went to bed. Normal. Day 1 after the hike. He feels a little tired. He chalks it up to the heat. Day 3, mild headache. He takes ibuprofen. Day 7, he's exhausted, not normal tired, the kind of tired where getting up from the couch feels like climbing a mountain. His wife notices he seems off. He forgets to pay a bill, misses a friend's birthday text. Small things. Week 2, the headaches get worse. Throbbing. Positional, worse when he bends over or stands up quickly. He goes to his GP. His doctor runs blood work. Standard CBC, metabolic panel, Lyme disease antibody test. Everything comes back. Normal. His doctor tells him it might be a virus. Rest, fluids, follow up if it gets worse. It gets worse. Day 18. DM's wife notices something terrifying. He repeats himself, the same sentence, twice in 5 minutes. He doesn't realize he's done it. Day 21. He gets lost driving to the grocery store, a store he's been to hundreds of times. Day 24. He's sitting at the kitchen table. His wife asks what he wants for dinner. He looks at her, opens his mouth. The words don't come. This is called expressive aphasia. The thought is in his head, but the brain's language production center has broken down. He knows what he wants to say, he just can't say it. In a healthy brain, a region called Broca's area handles the assembly of speech, words, grammar, the mechanics of talking. It all runs through here. When that region is inflamed, disrupted, or starved of proper blood flow, speech production fails. Not hearing, not comprehension, just the output. It's like the printer running out of ink while the document is perfectly written. His wife calls 911, and now DM is in the emergency department, where the real medical nightmare begins. The ER team moves fast. They suspect stroke first. It's the most common cause of sudden speech loss in a 54-year-old man. CT scan of the brain. MRI with contrast. No clot, no bleed, no infarct. His brain looks structurally normal. Okay, not a stroke, encephalitis, inflammation of the brain caused by a virus. Herpes simplex encephalitis is the most common culprit and a medical emergency. They started empirically on IV acyclovir, an antiviral, just in case. Lumbar puncture, a spinal tap. They extract cerebrospinal fluid, the liquid that bathes the brain and spinal cord, and send it to the lab. Results, slightly elevated white blood cells. The brain is inflamed. Something is causing it, but the viral panel, herpes, EBV, CMV, West Nile virus, all negative. Now the infectious disease team steps in. The patient hiked in New England. Tick country, Lyme disease, caused by Borrelia burgdorferi, is known to infect the nervous system in its later stages. It's called neuroborreliosis, and it can cause exactly this: confusion, aphasia, cognitive. They test his blood. They test his spinal fluid, negative, no Lyme antibodies, anywhere. The team is stumped. They've ruled out the 3 most likely answers. The patient is getting worse. He's now having trouble recognizing faces. This is not a stable patient waiting for paperwork. This is a man whose brain is being destroyed in real time, and nobody knows by what. One doctor on the team orders one more test, a test most hospitals don't run routinely, a test looking for something most doctors have never seen in person. The PCR comes back, Borrelia miyamotoi. Let's talk about what this is and why it fooled every test they ran. Borrelia miyamotoi is a spiral-shaped bacterium, a spirochete, transmitted by the same black-legged deer ticks that carry Lyme disease. It was first discovered in Japan in 1994 in the tick Ixodes persulcatus. The first human cases weren't documented until 2011 in Russia. The first US cases followed in 2013. Here's the crucial part and why DM's tests kept coming back negative. B, miyamotoi is not the same bacteria as Borrelia burgdorferi, the Lyme disease bacteria. They are cousins, related but genetically distinct. The standard Lyme antibody test, the ELISA, works by looking for antibodies your immune system made against Borrelia burgdorferi. But your immune system makes different antibodies for different bacteria. B, miyamotoi has different surface proteins, different antigens, so your Lyme antibodies don't recognize it, and the Lyme test doesn't detect it. It's like using a metal detector to find plastic, the right tool for the wrong target. There's one more layer to this case that made it even more dangerous. DM had a history of cancer, now in remission. But as part of his treatment, he had received a drug called rituximab. Rituximab is an immunosuppressant that specifically depletes B cells, the white blood cells responsible for making antibodies. This is critical. Even if his doctors had tested for B miyamotoi antibodies, they wouldn't have found any, not because the bacteria wasn't there, but because his immune system had been chemically prevented from producing the antibodies that fight it. The bacteria had colonized his cerebrospinal fluid, and his immune system was too suppressed to mount the defense that would have normally triggered a fever, a rash, any early warning signal. He just declined, slowly, quietly, until his brain stopped working. Once B miyamotoi was identified, treatment was straightforward. Intravenous ceftriaxone, a powerful beta-lactam antibiotic, to cross the blood-brain barrier and attack the bacteria in the cerebrospinal fluid. B, miyamotoi, like other Borrelia species, is a spirochete with a distinctive cell wall. Ceftriaxone disrupts that cell wall, the bacteria cannot replicate, and the population collapses. After 2 weeks of IV therapy, DM transitioned to oral doxycycline, completing a full 4-week course. By week 2, DM spoke his first coherent sentence since admission. He asked his wife what was on TV. She cried. By week 4, his short-term memory was returning. By week 6, he was discharged. He didn't make a complete recovery overnight. He still occasionally pauses mid-sentence, searching for words that used to come instantly. But he's home. He's hiking again. And this time, he checks for ticks. So what do you take from this? DM's case is rare, but the conditions that created it are not. Borrelia miyamotoi exists in the same tick populations as Lyme disease. Northeastern US, upper Midwest, Pacific coast, and across Europe, any area where you'd be warned about Lyme disease is an area where B miyamotoi could be present. The bacteria can even be passed from a mother tick directly to her eggs, meaning larvae can already be infected before they've ever bitten a host. Most people who get B miyamotoi will have a short, flu-like illness, fever, fatigue, headache, and recover on their own or with a quick antibiotic course. But in immunocompromised patients, people on cancer drugs, autoimmune medications, anyone with a weakened immune system, it can cross into the nervous system and cause exactly what happened to DM. Here's what to tell your doctor if you think this might be happening to you or someone you love. Say these exact words. I want to be tested specifically for Borrelia miyamotoi by PCR, not just standard Lyme serology. Standard Lyme tests will not find it. You have to ask for it by name. DM survived because one doctor, knew what question to ask. Make sure you're that doctor for yourself. If this video helped you understand something that could matter one day, send it to a hiker. Share it with someone who spends time outdoors. The CDC estimates tick-borne diseases have tripled in the past 2 decades, and B. miyamoto is still largely invisible in that data because most labs aren't testing for it. The more people who know its name, the more people who survive it. I'll see you in the next one. Stay curious, stay well.